This is an upper left wisdom tooth that we're going to be removing in this video. Here's an x-ray showing the tooth in question. The patient's chief concern was that food kept getting lodged in between their back teeth in the upper left, and the reason for that was because there was a gap between the wisdom tooth and the second molar due to the fact that the wisdom tooth did not have a partner in the opposing arch to chew against. And when a tooth is unopposed, it will erupt out of the socket, leaving a gap that is difficult to clean. So the patient was presented with two options. The first option was do nothing and clean it as best as they could. Option number 2 was to remove the wisdom tooth since it was a non-functional tooth and the patient wanted to have the wisdom tooth removed. Going to get started with the clinical footage by anesthetizing with an infiltration into the first molar area, followed by a PSA block, and then some palatal infiltration. And I'll always infiltrate using 1 in 200 articaine, which has been shown to be the most effective anesthetic for infiltration. Once the freezing is settled in, we're going to go in with a small elevator and separate the tooth from the gum tissue, and then begin luxating the tooth with slow and steady pressure. And once we have some mobility, we're going to go in with a larger elevator and continue luxating the tooth further until it's ready to be delivered with a pair of universal forceps. So we're going to deliver the tooth with a pair of upper universals, and the tooth comes out nice and cleanly. Going to have the patient bite down on some gauze. The patient wanted to keep the tooth, so we're going to rinse it off and put it in a little box and give it to the patient to put under their pillow.